This program is sponsored by
Lanka Hospitals. Caring, curing.
Hello everyone, welcome to Art Mediline. Art Television together with Lanka Hospitals bring you this program to make you aware of your health and well-being. Talking about Lanka Hospitals, they are the market leader in the healthcare industry, bringing you the best of medical services with the best of specialists in the country to all the Sri Lankans and also for the international representatives in the country. Now coming into today's program, we are going to talk about the advantages of MRI scanning. And to talk about this, we have Dr. Eranga Perera, Consultant Radiologist with over 15 years of experience in the field, and she is a resident Consultant Radiologist at Lanka Hospitals with special interest to MRI scans. Hello Doctor, how are you? Nice to have you with us today for the program.
It's nice to be present in the program as well.
Great. So let's begin the conversation with Doctor. Give us a brief introduction about what is radiology.
Yeah, basically to start with what is radiology, it's actually helps a person, a clinician, to diagnose what the disease is. So if some person, a patient is sent to us like to diagnose what the disease is, you can use a lot of imaging methods. So the oldest method we used was the radiography, that's the X-rays. And then came the ultrasound and then the CT scanners, and now we have the MRI and the PET scans, and it goes on like that. So actually it's an imaging method to see the inside of the body, what is wrong, and we help the clinician to make a diagnosis.
Right, now coming into today's topic on advantages of MRI scans, that's what we are talking about. So let's have a brief introduction about MRI scans, Doctor.
Yeah, that's actually my pet field also.
All right.
Right. So the main advantage of MRI is like it doesn't have radiation. So all the investigations except ultrasound, like we use the X-ray to make an image. MRIs make the image using a magnetic field, not the X-rays. So the main advantage is you can image anybody, like a child, a pregnant mother, and expecting a girl, and younger age population, whatever, you can image without a fear of radiation. And second is like mainly you compare MRI with the CT scanner. That's the competitor. So when you compare with the CT has radiation, whereas MRI don't have radiation. Other thing is like if you have the experience of imaging a CT scanner, you know that there are only few images that you can get at once. But whereas if you go for a brain scan or whatever the body part you image in MRI, at one go you acquire a lot of images. That's the second advantage. So like that, whatever like the soft tissue, we say the clarity of an organ and soft tissue is more enhanced in MRI than the CT. So those are the main advantages in MRI scan.
Okay, coming into that, let's also talk about the special features of MRI scan at Lanka Hospitals Radiology Department.
Yeah, we are actually proud to say that we have a 3 Tesla MRI scanner that is a higher magnetic field. Higher the magnetic field you use, higher the image quality. So we in Lanka Hospital have a 3 Tesla MRI scanner, and the image that you see now is the MRI scanner that we have in Lanka Hospital. So we have a very wide bow scanner. What do you mean by the wide bow is, if you look at the scanner now, you can see that there is a table-like thing and around the gantry. So the patient lies on the table, and for the imaging, you have to send the patient into the gantry, the hollow thing. So there are kind of patients that you are unable to go to a closed place, what you call the claustrophobic patients. So we have a very wide gantry, like 7 centimeters, to reduce that. The patients feel better. And the second one is we have a lot of coils to image. What do you mean by coils are like not you have an MRI scanner that would not give you images. So each part of the body is imaged through a coil. You need to have a separate coil for the head, separate coil for the shoulder, and for the legs, like that. So we have vast number of coils where you can image the whole body part by part. That's the second feature.
Right, doctor. What are the most common types of scans done through this MRI scanning?
If I say like nowadays, the most common scans are limited to the central nervous system, that is the neurosystem. The commonest scans we do are the spines. We have a lot of spine problems in Sri Lanka. From the childhood, the pediatric age group, to the young and the old, we all need, we all have backaches. We all have different kind of diseases in the spine. So that is the most common scan that we do.
All right.
And the second most common is the brain. That is, we commonly have the headaches now, different types of headaches, different types of diseases we have diagnosed, recognized in the recent history. So spine and brain are the most commonest.
Spine and the brain.
Yeah.
So if you take us through the process of the scanning for the spine, how does it happen, doctor?
Yeah. So I will show you an image. Like spine also you can do, like if you want to image the spine at once, the whole spine. This is what you call the whole spine. You can image that as once.
Okay.
So like I described you first, like you make the patient lie on the bed, and according to the need of the clinician, if they ask the whole spine, that we can image the whole spine, or the pain or the pathology is limited to one region, like in the neck or the back, the lower back, separately we can do.
Right.
That's what I said, like when you have separate coils, we can do separate sections.
Right. So is it the same process for the brain scanning, doctor, or is there any difference in the scanning process?
There is a difference, like spine we do not intervene that much, like you operate but we don't interfere.
Okay.
Like in the brain, with the new advances, we also help the neurosurgeons to how to operate, like what is the safest way to approach a brain tumor. The commonest thing the surgeons request us is a brain tumor. Like when they go to the theater, the new technique is the neuronavigation technique. That is, the neurosurgeon navigate his path to the brain without damaging the rest of the brain matter. So that we help through the diffusion technology. This is a separate technology. I will show you a image where you see all the different pathways that the nerves are sent through the brain. So you avoid those pathways and you try to reach the brain tumor without the minimum damage to the residual tissue.
So if you can just explain a bit on this diffusion part, doctor.
Yeah.
How does that happen?
So again I will show you the image that will be, so you can see different colors in the brain and they are in lines.
Right.
So our brain is actually a network which is connected, interconnected.
Yes.
And it has separate sections like to hands, to legs, and to smell and vision. So these lines show you each senses how they are traveling. So the green would be from the front, like from the hands to the legs, and the red would be from one side to the other side, coordination. So this is a new advanced technique that you use in the MRI to depict the diffusion tracks. We call them diffusion tracks. Actually, they are the nervous pathways. So the neurosurgeon knows which is how to cut the tumor and to take it out without damaging the rest of the pathways.
I'm sure that is the wonder in
Of,
medical
yeah.
the industry these days, where you do not really damage any part of, especially brain. I'm sure
Yeah.
it is a very sensitive part
And
of a
it
human.
doesn't regenerate. If it is damaged, it is forever.
Right.
So you have to be very careful when you handle. Yeah.
That's why we say doctors do wonders. So along with that, doctor, I would like to ask you, how long will this process actually take? Let's say spine or a brain scanning.
Yeah,
What is the
actually,
time
that's a good
duration?
question. The shortest, like in MRI, like the shortest scanning time would be like 20 minutes.
Okay.
Because it's a lengthy, like the acquisition of the images, it takes a long time.
Right. Okay.
So usually compared to other scanning techniques like imaging techniques, MRI is a lengthy study.
Okay. So the shortest is 20 minutes. So
Yeah.
for 20 minutes, the patient will be inside this
Yeah,
scanner.
yeah.
Right. Longest, if you just take with an
Longest
example?
we do is 1 hour.
What kind of a scan would that be?
That is, we check actually the function of the brain.
Right.
So we need to coordinate with the patient. We
Okay.
educate the patient to raise one hand, and we try to see the signals. We try to acquire the signals from right hand where it is lighting like a bulb in the scan. So
Okay.
for that procedure, we need coordination with the patient, and we give time to the machine to acquire images.
Right.
So it takes a little bit time.
Okay. Have you had experiences where patients have got really panicked or they've got scared?
So usually we are all like in a time like that. We all get excited. It takes time to make them calm, make them understand, then slide through
I'm
the
sure
machine.
being inside a scanner for 1 hour.
Yeah, we try to keep a bystander, like one of their
Right.
relatives.
Okay.
Like if the scan is taking too long, we try to keep somebody next to them, holding the hand, so they know that there's somebody there. So yeah, we day to day, like we have certain cases where they couldn't tolerate it at all.
Yeah.
There are times that we have to use general anesthesia to perform the scan to calm down the patient.
Right. But there's actually nothing to be worried about, no,
Nothing
doctor?
to be worried
Yes.
about, only that we, in a time like that, we all are like under the stress.
Yeah, we have to calm ourselves. Now you said you will let one of the relatives hold their hand. So in such a, let's say, a brain scanning process, only the upper part of the body will be inside the scanner? Or? Oh,
So the rest of the body, the hands will be out.
outside.
Either the person can touch the leg and or the hand, so know the presence of them.
Right. Okay. So doctor, now we spoke about the spine scanning and also the brain scanning.
Yeah.
Other than these two, are there any other types of scanning which you do for the body? Is it
Yeah,
possible?
certainly.
Okay.
Because actually MRI, when it is when it originates in the past, it was limited to the CNS, like I said, the brain and the spine. That are the easiest region to be imaged. But with all new advanced techniques and the coils, we can image any part of the body, like the liver, if you want to diagnose any liver masses, liver parenchymal diseases, like you say, cirrhosis,
Okay.
and the kidneys, the prostate, ovaries, and the womb. Everything, like in part by part, you can image.
You can.
Yeah.
Right. So I think it's now time to take a break out of this interesting conversation about radiology and MRI scans. So let's be back after a short break.
This program is sponsored by
Lanka Hospitals. Caring, curing.
Welcome after the break. So today we are in conversation with Dr. Eranga Perera, Consultant Radiologist, and what we're talking about today is about the advantages of MRI scan. Before the break we were talking about the other types of scans other than the spine and the brain. So doctor, coming back into the conversation, you mentioned that other than the spine and the brain scanning, there are other types of scanning which can be done to the body parts, such as the liver, kidney. So just to go in detail for all of these, how do you really take us through this process of scanning in MRI?
Okay. I'll give you an example, then it is more easy to understand.
Sure.
So if you take a patient with cirrhosis, like that is we call the chronic parenchymal disease, right? So it can come in a patient like a male or female or a child. It's a common thing. So they have found that new technology that is to enhance the masses in the cirrhotic liver. Cirrhotic liver, now we have found that, so with so many researchers, it has a tendency to go through developing cancer, what you call a hepatocellular carcinoma. So they start with minute one and then it grows in size. So earlier you detect, the better. So we advise the people who have cirrhosis to get a scan done regularly. There are some blood investigations, tumor markers that you do parallel with the MRI imaging. So they have done research and shown that MRI is very sensitive because it has some like diffusion, it has some imaging sequences where it is very specific and very sensitive. You compare with the other imaging modalities like CT also. Even if you do those two, like you end up doing an MR. So it has a very high soft tissue clarity. That is why I say soft tissue clarity is highest in the MRI. So the minute one, like less than 1 centimeter, you can better detect in MRI. So that's one example. And the other one is like prostate cancer in men are becoming very common. And in the West, they use this MRI scanner to screen, and the same way like the liver, you do some parallel blood test, and when some markers are high, with parallel blood, you can do MRI. We call it like multi-paracentric imaging. You do a lot of, like I told you, other than not like the other scanners, you do a lot of sequences at once. So you gather information from all the sequences, all the like diffusion, you give contrast, and you get the kinetic curve, and you take everything and you give a mark, and the highest the mark value, higher the suspicion for the cancer. So it's it has proven very, very valuable this thing in diagnosing prostate cancer. So in the breast, same way they have developed a new coil for breast, and that also you have multi-paracentric imaging. So if you have a tumor or mass in the breast, the characterization is higher in MRI. So with the mammogram, ultrasound, you do MRI as well. So like that in kidneys, if you have a tumor, like if you can't go through a CT scanner because you are allergic to contrast or your renal functions are not good, that time you can do a MRI to characterize the tumor. So like that, there are so many organs like soft tissue clarity is good in MR. So you end up doing an MR for better clarification.
So what I gathered from your information is, Doctor, through MRI scan, all of these minute details of injuries can be identified in a very effective manner. Is it?
In certain organs, like I would mention like the organs which are subjected to move, like the lungs. We do not image from the MR because in MRI scan you have to be very still. Slightest movement will not give you good imaging. That will give you an artifact. So all this liver, prostate, kidneys, they are not subjected to move with the respiration or heart. So they give better imaging.
So it does wonders. So moving on, Doctor, let's talk about the sports injuries. How often do you get investigations in sports injuries?
It's very common. It's getting very common. Yes. People are engaged in so many sports activities now. They are becoming very conscious about the health, and in schools also there are a lot of sports related activities. So the best advantage, like best thing in MR is like it doesn't have, like I told you, it doesn't have radiation. So the pediatric, like the kids, the young generation can be exposed without a harm. That is the main advantage in sports related injuries. Other thing is the best soft tissue clarity. If I explain you what you mean by the soft tissue clarity, like if you take a joint, any sports related injury in our body, it will have a bone, it will have muscle, it will have tendons. Like it's from hard to the soft, most soft. So this will give you a nice image in the MRI. Like
right, a very clear image.
Very clear imaging. You don't get that kind of image in any scan. You can identify muscles separately. You can identify the tendons separately, the bone separately, and the tiniest tear you have in the muscle, tendon, you can identify. You can pick it up.
Right.
And like I said, like if you have the MRI scan alone, it will not help you. You have to have coils for each of these joint in the body
parts.
So we have a lot of scan coils. We have coils separately for the shoulder, separately for the knee, ankle, wrist, and the thumb, the fingers.
Fingers also.
So like you can have tendon ruptures, like when you're playing badminton or some small tendons. So we have a very micro coil where you can image only the tendons in one finger. So we get a lot of cases.
In sports injuries.
Yeah, sports related injuries.
Okay. When talking about that, I'm sure the public has a question, doctor, as what is the age group? Is there any age group for this MRI scanning, or do you advise it to any type of age? If you just talk about the age of people?
No, there is no age group. If we get a request from a clinician, we have performed like scans for a baby of few days old, like 3 days old, and probably the range goes up to something like 90 years. You can image any person. Only problem like in the pediatric, like younger, like the babies, you have to keep them still. So for that we sedate and then we perform, because they will not stay still for 20 minutes. So that's the only thing that you have to do in MRI for the infants.
But there's no definite age group. It applies to all.
It applies.
With
you can
no
just
harm, you can undergo the MRI scan. Okay. So along with that, doctor, now we spoke how it is not harmful and MRI has been evolving throughout the years. Let's talk about this technology advancement of MRI scanning. How has it come?
Yeah, if I say like the MRI started like to see the picture. We see an organ, and we when it is disease, we say that it is a cancer, it is a harmless tumor, it is not a tumor, it is just an injury. That is looking at the morphology, like the picture of the organ. So it has developed, it has gone through so many generations, and it has come to a point where you try to understand the function of an organ.
All right.
So we call it functional imaging. I explain you in the brain, like you can pinpoint where my finger is working, and if I work it, and if I move my finger and you do the scan and you get the point where it is involved in the brain. So that is functional imaging. And the same way they have developed methods to show the metabolic activity. That is part of the tumor doesn't have the normal metabolite content like the normal tissue. If you take the prostate, the rest of the prostate metabolite composition is different from the tumor part.
All right.
So there is a image acquisition, we call it spectroscopy, like the diffusion.
Yes.
It's a separate sequence, you say it's spectroscopy. So you evaluate the whole prostate, its chemical composition. So where the part is, where the tumor is, you identify the composition is different. Gives a pathological peak. That is the metabolic. So then now we are coming to the molecular advanced techniques, we don't use that in Sri Lanka. We are not that gone to that far.
Not yet.
Not yet.
Right. I'm sure Lanka Hospitals will be bringing you the best of technology with the time to come as well in all types of medical services. Along with that, Doctor, let's talk about how will you advise the public out there? How will people know that they have to undergo an MRI scan? If you just talk about it.
Yeah, I would suggest, like, if you have some kind of a problem, whether it is related to brain, your limbs, or your tummy, or the chest, you should visit a clinician, a physician or a neurosurgeon, neurologist, or whoever. The first visit a clinician, then he would examine you and would say which region to be imaged. That is very important. We should know which region to be imaged. So then he would give me an idea. This is the region, this is what to look for. So that is the first step I think you should do as a
go see a clinician, and then from there onwards you will be advised to go for an MRI scan, and then that's the time you come and meet a radiologist. Am I correct, Doctor?
Yeah.
Yes. So I think we had a very good conversation today on the importance and the advantagement of an MRI scan with Dr. Eranga Perera. So thank you so much, Doctor, for joining with Art Television today. I think that was a very productive conversation where you got to know that there's actually nothing to be worried about undergoing an MRI scan, and there is no age differentiation. Even the newborn baby to 90-year-old person can undergo an MRI scan very safely with all the technological advancements which have occurred in the time to come, and definitely in future as well. With that, we are wrapping up today's Art Mediline. Thank you for joining with us. I'm sure you gathered a lot of knowledge. See you next week again through Art Mediline. Thank you so much.
Lanka Hospitals. Caring, curing.